Good afternoon. Oops, I guess I should use one of these.
Yes.
Name over here.
There.
Okay. Hi, I'm Andrea Barsovic. I'm one of the two co-chairs of the Health Committee, along with Gigi Smith. Wave your hand, Gigi, so people know who you are. We have just recently taken over the chairmanship of the Health Committee from Joan Mount, who has done it for many, many years, did a wonderful job. This afternoon's program is Medicare and You. What are the recent changes and what are your options? Our speaker this afternoon is Dave Gingras. He's a licensed Medicare agent with Independence Blue Cross, and he's going to talk about Medicare options. He's not going to be talking specifically about IBX. He'll give a presentation. You have most of this. You have the slides in front of you, and then when he's finished, there will be plenty of opportunities for you to ask questions. Okay, with that, I'll let you get started, Dave.
Thank you.
Okay, you've got your own.
I do.
Yep.
First of all, I put in there some of my background. I'm a local person. I actually went to college with Bill McGargle down the street. It's a long street, Henry Avenue. And I went to Philadelphia Textile, then became Philadelphia University. Now it was bought out by Thomas Jefferson, along with 14 hospital systems. So now I'm a Jefferson alumnus. And I coached there for a little bit, so I got an MA in education, and I went to Wharton and got an MBA. So that's a little background. I went to Lower Merion High School, which, anybody here go to Lower Merion? I know Bill went to Haverford. It's right across the river, City Avenue. Lower Merion is on the Montgomery County side. So I'm a consumer. I'm 79 years old, so I've been on Medicare myself for 14 years. So I know the process from the consumer part all the way through the professional part. And a lot of, we're trying to get more older Medicare agents. Is that if you're 25 or 35 or even 45, you don't understand the whole Medicare system, how it started. So let me start. I gave you a handout so you can keep that. And I'm going to go through, there are two, Medicare is a federal program. It's very closely regulated. That's a good thing. And so the agents themselves deliver. There have been all kinds of war stories. About 99% of it's good. There have been people may have been sold the wrong thing, or their application got lost or something. So the point is, the Social Security Administration started Medicare in 1965. I was a senior in high school. I'm a single mother, 3 kids, and she went on Medicare. And I remember it didn't include prescriptions. It still doesn't. And that was a problem, especially a problem for her. Prescriptions had no regulation on prices. And so if you were in a hospital system, you got a discount, but if you weren't, you didn't. And so poor people really did have a problem. That's how Medicaid came along. That's another story. But the Medicare goes back to 1965, and the Social Security Administration oversees it. There's several divisions within it, CMS. It's very regulated. It's in the news all the time. It's on TV all the time, especially now. This is called, right now we're in what's called the annual enrollment period, AEP. Government likes acronyms. AEP, all that means is annual enrollment period. It means from October 15th to December 7th, you can change your plan. After December 7th, you're pretty much locked into that plan for the next year. So all of you, I'm sure you're all on Medicare. Medicare goes up to December 31st, and whether you're in a supplement, or Medicare Advantage, or just original Medicare, that's annual enrollment period. But then that's not over. The advertisements would imply that you have to do everything before December 7th. That's partially true, but not completely true. Because in January 1st, if back in October you bought something, it didn't really, you got the packet in the mail. The lawyers call that a prospectus. You look at the packet and you don't like something or you don't understand something, you can actually change it again between January 1st and March 31st. That's if you didn't know that. So you have to have a good reason. You can't just change it, but you can actually change it again. So that's called open enrollment period, OEP. So that's for everybody that's on Medicare. You get back in the beginning, when you're 64 and a half, 64 and 9 months, you can enroll in Medicare, and you should. If you don't, you could have a problem later. between 3 months before your 65th birthday and 3 months after. So there's a 6-month window between 3 months before you're 65 and 3 months after. So you apply to Social Security, they're online or in person. Their offices, they have live offices. They're shut down now, but hopefully they open up by next week. And you can walk in there, and especially in suburban areas, Philadelphia area, there are a lot of offices. You get up in rural Pennsylvania, you may have to drive a ways, but you can go in there and ask them questions. I've done that often because you call them on the phone, and you're caller number 3, and you wait for 20 minutes, and you're only caller number 2. So I'm going back to the beginning. So when you first sign up for Medicare, you get a card in the mail. You apply for the card, comes pretty quickly, usually within a couple of weeks, and that card gives you have a number. You all know what I'm talking about, a Medicare card? I call it the red, white, and blue card because you have a number. It's not your Social Security number. It was purposely changed because there was fraud with Social Security numbers. So we don't ask you your Social Security number. You have a Medicare number, and some of them have even been changed. So and on that card, it'll have Part A and Part B. I'll go into a little explanation of what Part A and Part B mean. Those dates are on your card. Those dates are important because if you change your plan, they're going to ask you what's your number, what's your Part A date, and your Part B date. It's going to be pretty close to your 65th birthday. So you want to follow me on, I don't mind if you follow me along. I want to give you something to take with you. That's why I didn't do a PowerPoint. You see this explanation, the 4 parts of Medicare. You ever hear the term original Medicare? Okay, original Medicare is what the government gives you when you turn 65. And it's pretty much paid for from all the payments. So you've been paying into Medicare. I started out working at 5 and 10 when I was 15. My money, even back then, I was putting money into Medicare. I didn't know it, but I was. So original Medicare, I describe it in my own explanations, 80-20. So if I have a $100,000 heart attack, the government pays $80,000, and I pay $20,000. That's original Medicare. Well, most people don't have the $20,000 or whatever the amount is, and so came supplements. And we'll go into a little description here. Original Medicare did not include prescriptions, and it still doesn't. And supplements rarely include prescriptions. Supplements I'll get into in a second. The 20%, supplements developed from the 20%. So the $100,000 heart attack, very few of us have $20,000 around to pay the $20,000, and so supplements came along to cover the gap. It's also, the term Medigap means the same thing as supplements. It's synonymous. Medigap and supplement mean the same thing. They covered the 20%. So, and we talk about on page 3, parts A, B, and C. Original Medicare was A and B, which included hospital and Medicare, medical care. The C came along with what you call Plan C is Medicare Advantage. I'll get into that in a minute. Some of you may be on it, some may not. I've been on both. Been on all 3. I was on original Medicare when I was 65 because I worked for an insurance company. I had health insurance at work. So the drug plans are carefully monitored by the government. In fact, Biden, if you remember, some of you are diabetic. Biden put a cap on Medicare, like insulin, for example. Could have been $1,000. They capped it at $35. So that was one thing that came out of the last administration was very, very helpful. Prescription, you know the term generic drugs? You know what that means? Okay. But they're off patent, so they're, like I take metformin, it's like $2 for a 9-month supply, as opposed to a 3-month supply, rather, 90-day supply, as opposed to some of these things. Anything you see on TV is under patent. That's why it's so expensive. And that's why they can afford to put ads on it. So in the diabetic world, Trulicity, Mounjaro, Jardiance, these are now common names because you see so many ads on them, but those are very expensive because they're very effective. So there's a lot of research, especially in diabetes, in the last couple of years. That's a good thing. But so you're finding synthetic insulin and all kinds of things that have tremendous effect on your weight loss. Okay, original Medicare, in the bottom of 3, they give a short explanation of what Part A covers. Hospitals care, So original Medicare with A and B. Part A covers hospital care, skilled nursing facility care, which you have here too, nursing home care, hospice, and home health services. So it goes through your entire life cycle as senior, your entire life cycle from maybe not even hospital care all the way to home health services and all the in between, okay? Part B covers doctors and other providers. You have hospitals, A, B, or doctors. And the same thing, your Part A, pay Part A in your card, that's the same category. That's where that's an election you get, you pay a little bit for, Part A and Part B. Part B covers doctors and other provider services, ambulance services, durable medical equipment, mental health, and limited outpatient prescription drugs. And all of us in this room have probably experienced some level of that. So you know what I'm talking about. It's not like you're part of the market, frankly. So it's all connected. Let me just, I'm using this so we don't miss anything here. So Part C, Medicare Advantage. So Medicare Advantage was developed because a lot of people, supplements became very expensive. All they included were supplemental. You covered the part of the bill. Didn't include meds, didn't include vision, hearing, any of the extras thing. That became a very competitive business. But let me just, how it started was medical costs, going back to the beginning, 65, were kind of somewhat out of control, especially here. We live in an area has the best medical care probably in the world. You have several research hospitals. You have Temple, Penn, Jefferson. You have Drexel. You have great hospitals. You have great networks. Well, in the course of a week for me, I could cover anywhere from the New York border all the way down from Pennsylvania. You go to a city like, say, Hazleton or Wilkes-Barre, they barely have, if they have a disaster, they barely have the capacity to do that. Their prices, by the way, are about a third of what they are around here per bed. I mean, so that's, we live also in the most expensive medical area probably in the United States, New York included. The Northeast is very expensive. Anyway, so Medicare Advantage, just following the script here, so government subsidized option to receive Medicare benefits through private plans. Now, the government would like to get out of the direct Medicare business. They probably won't be able to do that, but what they're trying to do with Medicare Advantage is taking it from the government to the private sector. That's and that's a good thing around here. I mean, in some areas in Pennsylvania don't have very little medical care at all. So they're trying to transfer the 80-20 and control costs. That to do that, how do you do that? Go back to HMOs, health maintenance organizations. You know what they are? They were started by an alumnus of Philadelphia College of Pharmacy and Science to get control because the medical profession, to be fair, probably was kind of out of control. There were they had no standards, so to speak. And so you've seen a consolidation over the last 30 years. You've seen doctors sell their practices to systems like Penn. Penn used to be Penn Hospital. They didn't have, now they bought out a lot of medical groups, so they're part of the Penn system. So did Temple, so did Jefferson, so did any major hospital group. So that's what's happened in the last 30 years. So doctors, you all know a lot of doctors. I grew up with a lot of doctors. It's a tough business. For an OBGYN, for example, nobody makes an appointment to deliver a baby. So they have to be based on 24/7 notice as opposed to something that's more controlled. But as you go down this list, many they added prescriptions. I gave you the example of my single mother trying to pay for prescriptions. A lot of us have had advantage. So there are people that need prescriptions now that are on patent, they can't afford them. So you can relate to that. But so they added prescription plans, and that was another industry that probably needed some control. The manufacturers of the pharmaceuticals spend a lot of money on research, but when they get something that's going to work, they really charge incredibly high prices. You take any of the synthetic insulins, they're like $1,000 a month. So or some special, some of you have been on specialty, they work, but they're not cheap and they're definitely not free. So now in Medicare Advantage, they will make the point, many of these plans have zero premium. So they're included in the, you pay Medicare Advantage. I'm not getting, is that still working right? Okay, all right. So a lot of you have supplements, right? Does the price go up every year?
Yes.
Every year, guaranteed. May not go up a lot, but it's going to guarantee it's going to go up every year. That's one problem. The prescriptions are another problem. It doesn't include hearing, vision, dental, some of those other services you might need, which Medicare Advantage does. So this is not about Medicare Advantage. I want to be able to compare the two because the companies that sell supplements a lot of times are not the same companies that sell Medicare Advantage. And so either side doesn't have a lot of good things to say about the other side. So right now, I get a couple phone calls a day about, well, my supplement went up $200. So you get a lot for it. If you may have cost them $200,000, but that's Medicare Advantage. On the other hand, has no underwriting. If I go and apply for a supplement today, I have underwriting. In other words, they can ask you medical questions. Medicare Advantage is guaranteed issue, meaning no matter what your conditions are, and I've had several of my clients who were terminal and went to Medicare Advantage, and you're allowed to do that. So it's just, that's one key thing. Supplements have underwriting, and if that's why you don't want to drop it if you have serious issues. But I'm talking about the money part. Medicare Advantage is guaranteed issue, but you have to work in a network. That's the difference. A supplement, you go anywhere you want, as long as they have a license and going to treat you properly. But the point is, you can go to any doctor you want to with no boundaries. If you're in a Medicare Advantage plan, you're dealing with a network. In this area, the network is Philadelphia, Delaware, Montgomery, Chester, and Bucks counties, 5 counties. So whether you're Temple or Penn or Jefferson, this is the market. Suburban Philadelphia is a 5-county market. So the Medicare Advantage plans around here, which should be, and I'm licensed from Wood Independence, Blue Cross. I'm licensed with Jefferson, Aetna, Cigna, Humana, United Health. They're all good. They're all controlled, and they all have slight things that are slightly better and slightly worse than the other one. So what it's down to is your doctor. Now you probably have doctors you're very attached to. They're right by you. You want those doctors. You want them to be in the network. So to work with Medicare Advantage, you have to work in a network. That's one key difference. If your plan does not have prescription drugs, you can buy a freestanding plan. Companies like Aetna, WellCare. Some of you probably have WellCare. Do we have WellCare? Okay, all right. So they are prescription companies. You can buy a freestanding prescription plan. If you came from the self-employed part of the world, they call it creditable coverage. If you didn't have, as you come up to age 65, if you didn't have credible prescription coverage, they actually charge you a penalty of about $17 a month for the rest of your life. That's Social Security actually. You aware of that?
No.
I am, because that happened to me. And I had credible coverage. I had to go prove it. My wife was a teacher, and I worked for an insurance company. I was also a broker. A broker means an agent could be with one company. It could represent several companies. So if you go into Walmart and you see a Medicare table there, those agents have to represent at least 4 companies. They can't just, like me, we all tend to favor a couple companies, but you have to represent 4. So I was in a Walmart last year, and a lot of Humana patients, they had questions about Humana. Well, I wasn't licensed with Humana, so one of the other people at the kiosk were. So just let me look, make sure we cover everything here. I'm bottom of 4. Monthly premiums vary. The average for a prescription plan, freestanding prescription plan, is about $38 a month. It is usually included in Medicare Advantage as part of it. Let me explain what they do. If you go into Medicare Advantage, you're agreeing for the government to take your Part A money and your Part B money which comes to about $800 a month, and give it to the Medicare Advantage carrier. It could be Independence Blue Cross. So that money goes from Social Security, actually sends that money transferred by wire, not like they send them a check. They transfer by wire, millions of dollars. And now Independence Blue Cross or Cigna, Humana, they have responsibility for you in that system. And that system includes the hospitals, like Jefferson. Jefferson's the only one that has both the Medicare Advantage and their own hospitals. Penn, Temple do not. Geisinger, which is upstate, they're small compared to down here, but Geisinger, which is out of like Scranton, they have their own hospital, and they also have their own Medicare Advantage. That doesn't mean anything to you, but that's giving you a little bit of background on how these pieces fit together. Hopefully I'm not confusing you. Higher income enrollees pay a little more for Part B and D. So it is graded by your recorded income. So Social Security, the IRS, they all trade information back and forth. You put down they can check your income. I probably won't have time to discuss Medicaid. Medicaid is another whole story. It does make it confusing, but let's go over to 5. This year meaning next year, 2026. The Medicare year ends New Year's Eve, 12/31. That's the end of the year, January 1st, the new plan. You're either in the same plan, every same plan is going to have some slight changes, or you're in a different plan. In Medicare Advantage, you're allowed to change plans. You're allowed to drop a supplement and go to Medicare Advantage. You don't do the other way. You're allowed to drop your Medicare Advantage and go to a supplement. You can do that in open enrollment period up to December 7th. And then that cuts off. They send out all the information. You get the prospectus in the mail. You like it, you don't like it. You can then make another decision in January. Medicare, the government subsidizes it, but I don't get into the mechanics of it. I would confuse you, and it doesn't really matter for the purposes of this. Prescription drug plans, they must be purchased in addition to Medicare Parts A and B. Most Medicare Advantage have it as part of it. It's not separate. It's included in the price. And you see these ads, zero premium. Well, let me explain that to you. It's not, zero premium is not free. It's not free because you're agreeing to transfer your A and B premiums, which come to about $800 a month, say from original Medicare to Humana or one of those companies, okay? And it says you can buy a standalone policy, you can buy a standalone prescription policy if you want. And you can ask them in advance what they charge. If you're on a very expensive specialized medicine under patent, you can shop it around. You do that homework in either in December, or you do it again in January. So there's a whole another 3 months, January, February, March, when you can review this. And you're going to want to review this every year for the rest of your life. And that's just good advice. I mean, don't be afraid of that. You're allowed to change it. You're not locked into anything. If you thought you were sold something you don't need, or it wasn't presented properly, you're allowed to change it. There's a whole system in place for writing that up. So with that, I gave you a lot of information, quick and fast. Do you have any questions? Take them one at a time. Huh? Yes, sir. And we're going to give you a mic too. So.
Yeah. Now this has to do with the coverage in a Medicare Advantage plan. When you have to choose in an HMO arrangement a doctor, my impression is that here in the Philadelphia area, virtually everybody who's a doctor is in the HMO plan of, say, an Independence Blue Cross or some of the other big ones.
That's true.
So for us, it doesn't really matter in the sense that it would if you were in Scranton or somewhere
No,
else.
it doesn't. That's a good point. It's not like that all over the country. I had one of my clients was a Hahnemann nurse. She retired and moved to Georgia. And knowing what all the things we have around here, she being a nurse, where she lives in rural, and I got a Georgia license to cover that because I have some relatives in Georgia. And you have to have a license. And if I make a phone call to Georgia, I still have to have a Georgia license. Anyway, there are only two plans. She lives about a half hour from Atlanta. I'm using another state as an example because Pennsylvania, I can use the same example. We live in a rural state. We just live in the most urban part of it. We live down in the southeast corner. But, yesterday morning I was driving down from the Poconos, and you go through miles of, so the bottom line, she only had two choices. And one was Humana, and one was another one. And the same thing. Humana had a pretty good program, but there were no choices. Around here, I spent all my time this season. Yesterday I enrolled 8 people, and it takes about an hour apiece. Spent the whole day enrolling people, and you really have any choices. You need to check your doctors. If you want to make a change, you need to do some homework on your doctors and your meds. You want to make sure. First, I say to people, ask your doctor if they take Independence Blue Cross, Cigna, Aetna, and there'll be times when some will won't. And will the system, like you ever heard of a system with Tower Hill? More out, okay, Tower Hill. Well, they're in trouble. They, financial trouble. So you want to make sure your doctor is getting paid by the system, and they're comfortable with the system, especially your specialists, whether it's a cardiologist, a dermatologist, an OBGYN. You want to make sure that they're in the network. And you say, we have the biggest network in the United States right here. Independence Blue Cross has the biggest network of anybody in the system. But almost any mainstream doctor in the 5 counties, unless they're a very expensive plastic surgeon, some specialty that only rich people could afford, almost every internist, every cardiologist, dermatologist, endocrinologist is going to be in the system for all the plans, whether it's Independence Blue Cross, Aetna, Cigna, and Jefferson. So that's, yeah. Yeah. I probably over-answered the question.
I would like to get in contact with somebody to look over my plan, because I moved from the state of New York to Pennsylvania, and things got right different, and I do not understand everything.
Okay, we can do that. I do that. I'll give before we talk about it at the end. I can give you a card, and if you want any information, you can call me. That's voluntary if you want to. She's next. We'll go.
I currently have a Medigap plan, but it is beginning to cost me a lot of money. And I had not switched to Advantage because it seemed as though that was costing the government a lot more than the Medigap was. And I was kind of doing it out of kind of a liberal notation of not taking.
Well,
I'm suffering because
you're partially right. The government, we take all the Plan A and Plan B premiums they have in a big pot, right? And all the millions and millions of people they have in a big pot. The bottom line, they did lose money, but the government, that's one of the things they subsidize. So that's one part of the question.
Okay, but now I'm trying to figure out what Charlie is saying is that the Blue Cross Blue Shield, what's it called? I can't remember. Where you have to get the
maximum out of pocket.
Medicare Advantage?
Yeah, the Medicare Advantage but it's the one where you have to get the doctor's approval every time you go to a different.
No, the opposite. No, you don't.
Okay. Well,
if you do, you switch the plans, because you're allowed to switch Medicare Advantage plans every year too.
okay, so you can switch from Medigap back to Medicare Advantage.
Yes, you can. Let me tell you what the rules are, because a lot of people fall in that category. By the time you get to our age, every one of us has something.
You're right.
Or more. And I do too.
Yeah. Okay, so in other words, then, but you're saying that most doctors are in the. I haven't actually looked at IVX in a long time. Okay, so maybe it's worth looking. All right, that's what I needed to know.
We get your phone number to call it too, but it's not. I also represent Jefferson. I went to Philadelphia University. That's Jefferson. I represent other companies, but that's another thing. Generically, Medicare Advantage goes year by year. It's guaranteed issue, meaning they don't even ask you medical questions. You could have had a heart attack last week, and Medicare. And the reason is, think about it. The government has you no matter what. That's good. They own your health. They're going to pay for it. So the Medigap and supplement mean the same thing. The Medigap means we're covering the 20% gap.
Right, I knew
Well, but it's complicated. Some people don't realize that. It's 80-20. So, 80,000 for government, 20,000 for the Medigap, or you. Go, we got one seat back here. Next.
Okay, thank you.
I'll
So-
hold it right to your
Oh,
mouth.
okay, got it. I have a dental plan that predates Medicare. So how do I incorporate that? Could that be with the Medicare Advantage, or can you have more than one dental plan at once? How
Yes,
does that-
here's how it works. To be competitive, all Medicare, almost all, I can't say all of them, you can buy one without the dental, but almost all of them have a dental plan. It's a maintenance dental plan. What that means is you get $2,000. That some are 1,000, some are 2,000. You can pay extra for 3,000. One of them. That's also a network. It's either United Concordia or Dominion or other company. So that's maintenance dental. They will cover. This is an example. They will cover caps, but not implants. The big thing is most of them don't cover is implants. Some of them are starting to have that. There are companies like Aetna and Cigna that have their own dental company, and you can buy a freestanding dental program on top of that. For example, I mean, I have some dental issues too, and so I took the extra for $16 a month. I got an extra 1,000 on the dental, and I used that for a bridge. So that's that bridge took all the money. So anyway, that's in the real world. So you can buy a freestanding dental plan. Aetna has one. Delta Dental. Some of you have them. But some of you have them for supplements anyway, and you shop them around too, because it's not like whole life where you have cash value. The good news is, at the end of the year, you didn't have anything happen, and the bad news is the insurance company keeps all the money, and like your car insurance, they start over. You didn't have an accident, that's good. We'll keep all the money, and we might raise you a little bit too. Just so.
Okay,
So
we got
that's-
a question over
yeah.
here.
My plan is with Aetna, and it's called Aetna Medicare Advantra Premier Plus PPO.
Well,
What's the difference between Advantra and Medicare Advantage?
Well, some of those are marketing terms. What the PPO means, preferred provider. So you could get a doctor out of they'll allow you to take a doctor out of the network,
Really?
which is common too. That's the PPO stands for preferred provider. You prefer this provider. You want to pick them, and they're not in the network. So you have to call it, and I've had that personally myself too. So, and it's a good company. They're having a tough year too. Okay.
Whenever I'm going to a new doctor, I always ask the office if they take Aetna Medicare, and they say yes. They all say yes.
Well, most of them around here, they'd be true. I recommend everybody ask your doctor. Some of the things I said today, ask your doctor, what do you think about Jefferson? What do you think about Aetna? What do you think about Cigna? Because the doctor is the provider. All the insurance company is how to pay the bill. For your doctor, if they weren't treated right. I mean, Cigna went through that. It cost them a lot of money, really. Anyway, go ahead.
Medigap plans are standardized, correct?
Yes and no. And what I mean by that
Like,
is,
you know, they have the letters after them, D, E, F.
yes,
G.
well, those are government designations. They like,
Right, but,
like
and so
G.
that standardized them
Yes.
across.
right.
And does it make a difference if your plan, if you have an F and and this year they're issuing Ks?
You
Know
should,
what I mean?
you should do exactly what you're doing. You should ask about it, because it's a very today thing. For example, there's G and Plan F, and I don't completely understand myself.
Yeah.
But Plan G and Plan F, here's the fear, and the industry created this in a way. When Medicare Advantage came out, the people that sold supplements didn't sell Medicare Advantage, it's a different license.
Right.
I have to take a whole different set of licenses, including a federal test called AHIP, which is like taking a bar exam every year. I mean, if you don't study it, you're going to flunk, because the questions in the test are the new things. Okay, so
But the other question is, if the supplemental plans are, you have to get, the pre-existing conditions have to be,
that's what I call underwriting. Yeah,
Yeah.
They have pre-existing conditions.
so you shouldn't cancel it before they check
That's
out
true.
right?
Yeah, that's true.
But Medicare Advantage plans don't have, so if I wanted to switch from my supplement plan to an Advantage plan, that could be, that would happen, because that doesn't
Here-
care about
here's what the,
pre-existing.
here's what the risk is. You buy a supplement when you're younger, you're healthier, and now you have, things happen, whatever they happen to be.
Right,
And the bill goes up,
right,
and they're paying a 20% bill. So as that bill goes up, they're allowed to charge you more.
right.
And when you come into a supplement, they do underwriting. Medicare Advantage does exact opposite. They do no underwriting.
Right.
You could come in with a heart attack. The worst case scenario, let's say you had two bad things happen in a year. You got cancer and a heart attack, and that costs $200,000. Medicare Advantage has a maximum out of pocket, which may be more than your supplement. Catch this. So if you're paying $400 a month for supplement, that's $4,800 a year, right? Almost $5,000. And you're buying dental, and so you're putting in $5,000-6,000 anyway. Okay. But Medicare Advantage has a maximum out of pocket, and it's all explained in there for each one. They have to give a number. What would be your worst case scenario if you had 2 or 3 things happen in 1 year? And they call it MOOP, maximum out of pocket. And that usually comes somewhere between $6,000 and $8,000. So I say to somebody, if somebody's paying $200 for a supplement, keep it. If you're paying $600, I had somebody call me, husband and wife, each of them are paying $600 a month. That's 600 times 12 times for 2 people. Do the math. You're up $12,000 a year. So that's the major part of your income. So
Yeah, but that's always been the fear with, because
that it's a justifiable fear. However, I've never seen any case where the Medicare Advantage exceeded the maximum out of pocket. And I have relatives in that category or in supplements that I put them in. And you're right on that. You got to do homework.
I have Medicare Plus supplement, had for years. One of the things that did happen, however, was I wanted to change my supplement plan from one letter to another, because it was going to be less expensive, and the old one provided a coverage for a lot of travel, and I didn't need that.
This is a Medicare Advantage or
Medicare, no,
supplement.
Supplement.
Okay.
And when I did that, they did an evaluation, a new evaluation of Herb and me, my husband and me, to see if they wanted to do that, because they don't need to take me on a different plan if it's not safe for them. And when they did the examination, they told them that my eye doctor said I had some problem with my kidney, which wasn't true. It took me maybe 9 months to persuade them that I didn't have any of the things that they thought I had. I had some things, but I didn't have those things. And eventually they changed me to the cheaper plan. But they changed Herb right away because he's perfect. Everybody knows him.
How much did it increase?
Huh?
How much did it increase? Double? The rate went up.
No,
Your supplement didn't go.
No. The rate did not go up.
Okay.
I was getting coverage for something I didn't need anymore. And I knew that it would be cheaper. I checked to get the F plan or the N plan, I forget what it was, instead of the letter I had before. And so I was changing the letter of the plan within the same provider. So the same Medicare supplement plan. And that's where the problem, so be careful, particularly I think if you leave a supplement plan and you go to a Medicare Advantage, when you go back, and that's where
You go back 1 year.
go back, they're gonna look at you and say, are you that, they don't care what you were like before. They wanna know what you're like now. Have you had a heart attack? Have you had a stroke? Have you had this? In which case, the Medicare supplement plan will be much more expensive. If I'm wrong, tell me.
No, you're right. You're absolutely right. It's going to keep going up.
So don't make that change quickly because you can't go back.
Do a lot of homework. One point you made, if you change from a supplement to Medicare Advantage and you don't like it, you can go back to next year to the supplement, come back in. Not as simple as that, but you can do that. Okay.
Yeah, you can,
One
but
year
you have
after.
to.
1 year after, right? You're not bound by you're out. They have to take you back.
So they do have to.
Not the second year, but after the first year.
So if you get other illnesses, but you go back after a year, they have to take you back with the same plan that you had before?
Yes.
Okay, I didn't know that, thank you.
I can't answer on the price, but they have to take you back. Yes.
Okay. because
No, the
that's-
price may be that. There are caps on that too. It's a
Alright,
very
so
controlled
it should be.
process.
Don't risk it 1 year, but if you stay out longer than 1 year, the risk is you go back as an entirely new person with whatever health difficulty, or if you've improved, that'd be better, but with whatever health difficulties you've gathered in the last 2 years, that's gonna
raise the price of a plan or make it prohibitive.
Sure. Here's what, go ahead, sir. Go ahead.
So my question is, the biggest source of bankruptcy is medical bills in the United States.
Absolutely.
And if you have all this insurance that you're talking about, who are those people who are going bankrupt because of medical bills?
Well, they don't age it. I mean, I can anticipate what it would, why, or
They're
Why?
not aged though, these are people.
They're under
who are not-
65.
They're not 65.
when you got the whole
Yeah,
thing. I'm gonna give you an example. I have titanium knees, okay? I ran for 50 years. I never had knee injury, so the list price at Penn for my knee operation, $75,000. Independence Blue Cross, their negotiated agreement was $15,000. That's a big haircut, right? 75 to 20, to 15 rather. So in the meantime, the doctor's doing 6 a day, twice a week. So 6 times, even at the discounted price, they're 6 times 50, 90,000 Tuesday and another 90,000. So they still make plenty of money. Now, I paid $300. So that's just one example. Same thing would go for heart attacks. But coming back to that, the question, when they started Medicare Advantage, and the government instituted this, the government really would like to get out of the direct Medicare business. They probably never will be able to. The problem is, as more and more people go to Medicare Advantage, their pot of money gets smaller. So it's a very, the people they anticipate that, but who knows where that's going to go in 10 years. The point is they try to take all the negatives out, the underwriting, so it's guaranteed issue. So I've had people literally die in their first year of Medicare Advantage. And they anticipated that. They wanted Medicare Advantage. There was no underwriting. Supplements there is. There was no, the other problem was there were no meds. There was no vision, there was no hearing, no dental, no health maintenance, like you can join a health club. None of the preventative things, like the $2,000 they give you in dental is first thing most people don't do, x-rays and cleanings, just maintenance dental, prevent problems. Prevent heart attacks, have them join a health club when to change their lifestyle. There are a lot of components to that, but maybe more questions. I don't want to give you too many examples of
We had our Medicare Advantage under IBX plan canceled.
this year.
Yeah, this
Prime,
year.
right? Prime
It was
PPO.
called Elite, I think it was called Elite PPO. Anyways, it's
I was in
canceled.
the same plan.
And they gave us a letter. And said you can show this letter to a Medigap supplier, and then you don't have to get underwritten. You don't have to get graded. You get to get it at the regular price. I'm wondering if anybody else in this room has said their.
I didn't hear that. No.
I guess you have had yours.
No,
Is anybody else in that situation where your plan is terminated this year and you
Yes.
gotta find another?
Yeah.
Yeah, well,
Yeah.
that letter,
Prime
supposedly
PPO.
that letter is like a get out of jail free card when it comes to not being underwritten.
Well, I lived through that with, I got like it in my carrier. If you don't have a question, I'll come back to that. Okay, that was Independence Blue Cross Prime PPO. I looked at all the Independence Blue Cross plans, and that was the best one. I bought it myself. The problem was it was so good they lost money on it.
Yeah.
And the reason was they have a thing in there. If you go anywhere in 48 states, you can get Independence Blue Cross network prices at that hospital. And that hospital then can charge it back to Independence Blue Cross, and that's why they lost money on it. And they're allowed to drop one plan a year. And that was the one they dropped. I had the same one. So did some people in the room. So but they're allowed to do that. But you could go to another. You can go to another either PPO or HMO though.
Yeah, but I could also go to a Medigap
Yes, you can. I didn't know that.
without being under.
That's good. Probably with their Medigap they'd have to do it, but I don't know whether Cigna would take that. But anyway, yes, ma'am.
So I'm a retiree of Pennsylvania Hospital, which is under the Hospital University of Pennsylvania.
About as good as it gets.
So for years and years and years, we were covered privately under Blue Cross. So the hospital paid a portion, I pay a portion. Last year, they renegotiated the contract. The Blue Cross dropped the supplemental plan that we all had. And we're all under a Blue Medicare Advantage. And
Is that Highmark? company Highmark?
I don't,
The name of it's Blue?
I just know that it's called Blue Medicare Advantage.
Okay.
And what happens is, that, I mean, so far it's been fine. But if you, because we're all grandfathered in, if you choose not to go with that and you go out on your own and get something and that doesn't work out, you can't ever get back into the,
You can't get back in?
you
No,
cannot get
okay.
back into the university.
It's kind of a scare tactic, but I've heard that before too.
But so far it's been fine.
Okay.
Was
a little
scary at the beginning.
There's a whole evolution going on right now in Medicare, so it's gonna change every year. So you're gonna see more and more of it. It's like Biden with the diabetic drugs.
Right to your mouth.
Right to my mouth, okay. We've had an experience that I think people need to be aware of, and that is you can check your medication price online. And you should, if you're gonna take a plan, check your medication price online. For the same company, for the same drugs, all generic, our price per year might be $1,200 or $12,000. The same drugs, it depends if the pharmacy is preferred or in network or not. Last week I checked and the $12,000 was wrong. The high figure for plans was $136,000.
For a particular drug.
Well, it's, one drug triggers it, but for the whatever drugs, they're all generic. We stumbled onto this a few years ago when I went to renew a prescription. That was, I would call expensive. It was like $180 for 3 months, okay? And I walked in and he said, this is going up and it's expensive. And I said, oh, sure, I know. And he goes, no, it's $720 now to enroll. And so I looked it up on Medicare.gov and got it back to the original price. And they change from year to year, especially independent pharmacies, go in and out of network. So one year, an independent pharmacy may be the cheapest, the next year may be the most expensive. Same plan, same company. So it's one of those sneaky things you just have to be aware of.
Well, two things. One, you can check it online. You also can call them up when you number on your card, the plan you're in, call them up and ask them what it's going to be. And when you get a packet, the end of the year, you get a packet in the mail. It'll have the drugs in there. You should check them just like you should check on your primary doctors. Yeah.
I have a medication's expensive, and each year I ask for tier reduction at the beginning of the year. So it usually is showing up either fourth tier, the most expensive, or just not there at all. It's generic of sorts, meaning that there are a number of generics, but and so each year at the beginning of the year, I write a letter saying this, what tier are you in, and then they'll tell me it's 4, it's not on the list at all. And I say I need a tier reduction. I get my doctor to write a note that says, well, I have to have this particular thing and nothing else. And then it goes down, and it goes down quite a bit. I mean, it's gone down from $1,000 to $50, that kind of $70. So keep that in mind. If you have one medication that's looking very expensive, and particularly if you check and see that
Shop it around, absolutely.
elsewhere. I did look to see whether the other drugs, the drugstore, the mail order, and the 2 pharmacies that are approved, whether the price was any lower there, and it wasn't much lower. So what you had to do is literally get the company to reduce the tier, and I do it every year.
You should check it all out. And when if you say you sign into a plan this month or early December, and you get the packet in the mail, you should check it again, including the doctors. Call them up, tell them what you're doing. And, if a doctor prescribes something that's under patent, ask him if he has samples, he or she has samples. You'd be surprised, because there are lots of samples. I was on Jardiance samples for a year before I got a prescription.
This is a comment more than a question, and I'm listening to all these people's responses, and we're a fairly intelligent group of people, and this is complicated and complex, and I'm just wondering if it's purposeful that the powers that be make this so complicated that one can't hardly figure it out without expertise, because it's ridiculous that we are all here, college educated and beyond, and every year I sit through that thing, based on what your health does every year. You sit through that thing, you try to change, if you change, you have to have yourself pre-existing conditions. It's awful. And I'm just wondering, for those of us who are politically minded, how we might be able to affect some change of this, because it's an awful system.
Well, you're right, it does work. I mean, the politics do work. I mean, you see it, Biden administration, you can see it in the Trump administration, different things. You can see it. I mean, right now, Trump, love him or hate him, he's putting pressure on, all these pharmaceuticals are coming from other countries. Well, if we got in a war with China, and they're making half our pharmaceuticals, right now they're making more than half, that could be a problem. And meanwhile, Merck and all these other American companies are having a problem. Anyway,
Okay, one more question maybe?
sure.
Oh, I did-
We'll wrap it up.
Just like to verify something, I was talking with an agent, licensed agent, about getting a different policy. He made a statement that at a certain level, you don't have to pay the Part B monthly premium, which shows here is $206.50 next year. Is that true? Is there any exemption to not having to
It's
pay?
partially true, and I don't know exactly how it works. I know that people that have higher income actually pay more.
Then you pay more,
Yeah, pay more,
but nobody
okay.
pays less, huh?
No, some pay zero though. And Medicaid, that's another whole story. That's the best deal in America, but we don't qualify, so that's the way.
Okay, I want to thank Dave for this presentation and thank you all for your questions. I
One
think
thing I wanna give
if people want to have any kind of personal consultation with Dave, you certainly can do that. He is a licensed agent and he has to get a written permission from you to do a consultation. So there are forms that he's putting out there for anybody who wants them.
If you want to be contacted, I have to get permission from you to be contacted.
Yes, and there are plenty of licensed agents out there. I know there's been stuff on the forum,
Here's
people
some cards
asking.
too if you want.
And so there are lots of
Go ahead.
options.
There you go.
This is not the only one.
Okay.
But I thank you all for
Pass
your
them back,
time
your
and
phone
your attention, and look forward to having more
Pass them behind there.
presentations sponsored by the Health Committee.
Sure. Oh, yeah, the other thing, if you want a packet, here's an IBX packet. If you want packets from another company, I can send them to you too. We have them all in there.